Hello, my name is Lindsey and I will be presenting my report on the deinstitutionalization of state-run hospitals in America. So, what is deinstitutionalization? It is the moving of mentally ill people out of large state institutions and then closing all of these institutions. It started in the 1950s and is still continuing today. Many patients discharged had a severe mental illness. So that means that they had lifelong mental problems and they had nowhere to go after the state hospitals discharged them. And they had severe mental illnesses such as schizophrenia and bipolar depression. So what caused the deinstitutionalization? Budget cuts were a big thing that caused the deinstitutionalization of the state-run hospitals. The budget cuts have led to less staff and programs and facilities being open. The opening of community mental health centers also caused this, which was a great idea, but unfortunately this wasn't really realized. None of these facilities have been built or funded, and they didn't meet the needs of some of the patients that do better in a hospital sort of setting. And the cause of the budget cuts were in order for the federal funding to go towards the opening of the community mental health centers. But again, that didn't really happen, which is not, so there was no place for them to go. And then advocates for the mentally ill patients to be let into society. So many people didn't believe that the mentally ill should be pulled up in the hospital setting and believe that they should be free in society. Freedom is great if it is well managed by patients who are not in mental health crisis mode. However, as soon as these patients start to come into a crisis mode, they don't have anywhere to go in order to get back into their right state of mind. So this is figure 1, which shows the decline of the mental institutions of the United States of America. As you can see, around the 1950s here, we start to see a very steep decline there. And the fact that there were less hospitals available means that there were less beds available for these psychiatric patients to go as well. Alright, so who was affected? The mentally ill with no place to go. Once these hospitals closed, they were closed for good, and that means that when a person started showing signs of distress, they did not have a proper place to seek treatment. Before the deinstitutionalization happened, there were 500,000 psychiatric beds for the seriously mentally ill in the United States of America. That equaled around 340 beds per 100,000 individuals. In 2014, there were less than 100,000 beds, which equals 17 beds per 100,000 individuals. And that just isn't, there isn't enough for these people that suffer. And since the closures, a lot of hospital staff lost their jobs as well. They had to lay off staff, close programs, and turn away clients. And this means a loss of jobs and a loss of staff for these psychiatric hospitals. Alright, so the mentally ill in crisis mode. When we talk about the mentally ill being in crisis mode, that means that they are exhibiting extreme emotional distress or behavioral distress, considering harm to oneself or others. They are disoriented or out of touch with reality. They have a compromised ability to function or are otherwise agitated and unable to be calmed. It can be difficult to handle people when they are acting this way. So when the mentally ill are in crisis mode now, instead of going to a psychiatric hospital right away because there aren't very many state hospitals around anymore, they have to go to the emergency room, which means longer wait times for those who are not mentally ill. And limits hospital staff because mentally ill patients can be difficult to handle, and therefore they need more staff to care for them. And when the mentally ill end up in the emergency room, staff are often unsure how to deal with these sort of patients. The emergency room is kind of seen as a holding area for those who are mentally ill until they can find proper placement for these individuals. Staff typically spends twice as much time looking for beds for psychiatric patients than they do for looking for beds for non-psychiatric patients. And if there are no beds available for the psychiatric patient, they are often given a cocktail of medications and then released back into society. Private psychiatric hospitals can be choosy with who they allow to come into their facilities. If a patient has the wrong insurance or not a good history as far as staff goes, if they could have been violent or something, they are often turned away and they won't accept them into their hospital. However, the state hospitals accept even the hardest to place, but as you may have guessed it, these beds fill up very quickly because there aren't very many of them around anymore. And they can also end up in jail. So 45 out of 50 states declare that their largest mental institution is a jail or prison. And that's because they are causing distress to those around them or have done something illegal because they aren't thinking straight. So figure 2 shows the very large correlation between the closing of the mental institutions, which again happens around the 1950s here, and the rising the rising prison and jail rate. So this is the closing. This is the line for the closing of the state hospitals, and then this is the line for the prison rates. So as you can see, there is a very large indication that had something to do with the increase of the population. Okay. So homelessness and the mentally ill. So mental illness can make it difficult for people to get jobs and to keep them, depending on the lengthy treatment or because treatment can often take weeks or months for these severe mentally ill patients. And many of those in crisis mode cannot handle being in society. So job loss is something that can happen very often. And mental illness can cause delusions, and it can be very difficult for family to deal with them. And it can put a lot of pressure on families, and it can make home life difficult and sometimes impossible for the mentally ill person to be in their home and live with family members. So a conclusion: there is a lack of resources in the United States for the mentally ill. There should be a redetermination of the amount of state mental hospitals in America. There should be enough beds and staff to care for the mentally ill. And let's see. So what can be done? Obviously, a redetermination of the state hospitals, trained medical staff. So there should be trained medical staff in the emergency facilities that can handle oncoming patients that are experiencing a mental health crisis, including on-call physicians and social workers as well. The jail should the psychoevaluation upon jail arrival, so they should perform a psychoanalysis of those that are suspected of being in a mentally ill crisis mode. Upon incarceration. This will help staff to know what type of person that they're dealing with and get them the proper medication that they need and to a facility that can better handle them. Let's see. So I wanted to end with this graphic because I think it's very powerful. So essentially you have that they have a plan that will save even more money. So it's showing that the state mental hospitals are letting the patients out, and then the patients are going to jail, homeless shelters, private hospitals, nursing homes, dumpsters. Like, that is so powerful because obviously, like, you, instead of funding this, you are funding all of these places and the staff for these places and the running of these facilities, and obviously that is not saving us money in the long run. And then there are my references, and thank you.